So, like I said today, I'm going to be walking us through a word called salutogenesis. Salutogenesis literally translates to the origin of health, and it stands as a philosophical and practical counterpoint to, what we call pathogenesis. We are in the allopathic medical system, and all what we think about all the time is the pathogen, pathogen, pathogen. But you are seeing a complete contrast to what we call pathogenesis, and that's the word we'll be discussing today. Salutogenesis. Remember, pathogenesis, focuses on the origin and progressions of disease. Now, rather than concentrating solely on preventing or treating illness, salutogenesis explores how health is created and then maintained even in challenging environments. That's what it means. Now, it is a hybrid word or a classical compound, meaning that the word salutogenesis encompasses two words. One is called a celor or cellus, and then the other is called genesis. Now, celor is the Latin word for health, and genesis is the Greek word for origin or creation. So when you put the two together, you are talking about origin of health. And like I said, it is just the complete opposite of what we call um, pathogenesis, right? So what is health? What is health essentially? Is health a binary state? Like, do we refer to health as a binary state that if you are not sick, you are healthy? Now let's get to know what health is. Health, from the salutogenic, perspective, is not merely the absence of disease. It is a dynamic and adaptive state shaped by psychological resilience, social support system, and then environmental safety and stability. That's what it means. Now, your ability to recover from an illness essentially depends on these three determinants: psychological stability and safety, social support systems, and then the environmental determinants. So it depends on these three things, your system. So any time you socially interact with people, you boost your cellular immunity, and it determines how quickly you recover from an illness. So we talk about environmental safety and stability. Where you stay, the environment you live in, the amount of anthropogenic toxicants you are exposed to, all would determine how quickly you recover from an illness. Now, let's talk about the focal goal of health. Why do we treat you? Why do you go to the hospital? Or why do you want to gain health? What is the focal goal of health? The focal goal of health essentially is to strengthen your resilience. That's what it means, is to strengthen your resilience. Is to strengthen your resilience, is to give you, resources to manage your stress very well. And at the end of the day, to see that, you are healthy. That's essentially why treatment is offered in any place. So this model emphasizes strengthening individuals and collective resilience, developing effective stress management strategies, and promoting overall well-being. Driving from the traditional medical, or diverging from the traditional medical model, which largely centers on diagnosis and preventing disease. So the concept of salutogenesis was introduced in the 1970s by Aaron Antonovsky. Aaron Antonovsky, an American-Israeli medical sociologist, he first articulated his theory in his manual or seminar of 1979 book, Health, Stress, and Coping. Health, Stress, and Coping. So when you look at his seminar titled Health, Stress, and Coping, the salutogenic model was birthed, from that presentation or that seminar. Component of sense of coherence. Antonovsky conceptualized health as a continuum ranging from optimal wellness to severe disease, along which individuals constantly move. The salutogenic model proposes that movement along the continuum or this continuum is influenced by various psychosocial and environmental factors, which Antonovsky grouped under the concept of sense of coherence. Now, when we talk about sense of coherence, we talk about comprehensibility, we mention um, meaningfulness, we mention um, manageability. You know, when you talk about comprehensibility, it's just your ability to know that everything, that nothing is new, essentially. That is the summary of it, that nothing is new. Everything happening now has happened before. A disease has come, it has gone. You know, there is always a boundary to everything. Nothing is new. So by the time you understand that nothing is new and whatever you're going through will come and go, you have, you know, that fortitude to actually push forward, to see that you remain positive even in the midst of difficulties. And then we talk about manageability. You know, anytime you are in a difficult situation, you tend to think of the resources to cope with it, because we can't lie, we need money. For everything we do, we need money. Do you have the resources to cope? Do you have, you know, the social support systems? Do you have people around you that can actually support you morally, you know, spiritually and all that? So all that is grouped under what we call manageability. And then we talk about meaningfulness. What is the essence of you living? What is the basis of your existence, essentially? What is the basis of your existence? Why are you existing? Are you just existing to work, go to school, get married, or work, get married, start procreating? You know, you see your children go to school, and that, like, is that all about life? There should be a purpose. There should be, you know, that that drive. There should be something that drives you in life. There should be something that you tend to achieve in life. And that should be the focus of our existence. Our work can go, our children can go, anything can happen. But that inner yearnings in our heart, what we truly want to achieve, you know, should prepare our meaning to life. And by the time we put all this together, you see that the life will go on, you know, the way it should be. Now, under the terrain theory, we learned that disease stems from internal imbalances, not merely microbial invasion. Yes, disease essentially stems from, you know, internal imbalances. You know, when your internal system is not, you know, the way it should be. Maybe when they are highly toxic, when they have a lot of acid, when they are, you know, they are lacking the required nutrients. You know, it is these factors that will actually contribute to you having the disease, not an external thing. For example, a place that is supposed to be basic or alkaline in your system, if it becomes acidic, it will give rise to some microorganisms to grow. And those microorganisms under such an acidic condition can harm you. In this case, you cannot say it is the microorganism that is actually harming you, but the environment you created for them. So the terrain theory essentially focuses on you creating an enabling environment that will not allow the conceivable microorganisms to even harm us, because they are really part of us. You know, we are a working ecosystems of microbes. They outnumber ourselves, you know, in many, many millions, in trillions, that we can't say they are really the cause of any disease in our system. So microbes exist in symbiotic harmony with the body unless disturbed. Yes, we are working ecosystems of microbes. They live with us. We live with them. In fact, they are carrying us because they are more than us. So they are there in harmony. It is only when you disturb them, and that disturbance will come from you, you know, altering your happy homeostasis, your internal happy homeostasis. When your internal state is not properly built, is not properly balanced, those conceivably normal flora will become pathogenic in your system. So they are really not the cause, but because of the environment you created for them. Now we talk about nutrition, detoxification, lifestyles. They are crucial to maintaining cellular health. You know, the there are two unwavering pillars of reality that explains disease. One is nutrition. Another is what we call toxins. Now, when you have a buildup of toxins in your system, every disease essentially can stem from these two bases: nutritional dysfunction or toxicity buildup. When you have a lot of toxins in your system, you are bound to have any disease can come into your system. And then when you don't have adequate nutrients you're supposed to have, disease too can creep into the system. So we talk about microbial polymorphism. Microbes can change from depending or can change form depending on terrain condition. Yes, microorganisms can change. The polymorphisms of microorganisms. Microorganisms can change from one form to another depending on the environment you create for them. And then we talk about the role of the internal environment. Of course, we've discussed diet. We've talked about the pH. Your system has to be alkaline in nature. And then the detoxification. Our functional organs are vital for eliminating toxins. Sometimes we need to enhance them with some cocktails of fruit and vegetable to see that we detoxify our system appropriately. And then the stress management. Stress is not good. Chronic stress can harm us. We need to, relieve ourselves of stress. We need to, think of, the appropriate stress management strategy to adopt, and then we can actually live a healthy life. Now we talk about the modern interpretations of terrain theory in holistic health. Let's talk about holistic health. Modern medicine increasingly incorporates terrain theory through microbiome-based therapies, detox regimes or regimens, and nutritional plans, chronic disease protocols targeting mitochondria and cellular functions. Yes, so even in our allopathic medical system or the emerging medical model, we see that we are gravitating towards what we call, you know, the gut science, the gut microbiomes. We are beginning to, see that our health actually dwells in the gut. Like 80% of the immune system, like we say, is found in the gut wall. And over 85% of what constitutes the immune system, they are microbial in origin, all in the gut wall. So modern science is now beginning to embrace, the reality of health by incorporating, the gut or the microbiome-based therapy. We talk about the detox regimens and nutritional plans. Yes, it is becoming glaring that disease origin or the every disease essentially stems from like two things: nutritional deficiency or toxin buildup in our system. So we are beginning to learn that the body needs to detox. We need to supply the body with the necessary nutrients, and the modern science, the modern medical system or modern medical model is gradually incorporating that into the system. Then how do we manage chronic disease? We have learned over time that we can actually tweak or manipulate the mitochondria and then the cellular function to see how we manage chronic stress. For example, if you are in a sympathetic dominant phase, you are literally in a fight or flight modes. And how do you think we can manage that? How do you think we can manage that? It is by relieving ourselves, reversing the trend. There are some interventions. There are some interventions we can do to actually lower uh, our chronic states by targeting the mitochondria and cellular function. So now let's talk about the germ theory's core principle. The microorganisms are the primary cause of infectious diseases. It emphasizes on external threats, enabled modern infection control and public health practices. That is it. The microorganism in the germ theory, it states that microorganisms, they are the primary cause or the primary reason for every disease, and then and that this microorganism must come from outside. They emphasize on external threats and enabled modern infections control and public health. It is in line with this thinking that we have, what we have today. Like we talk about the antibiotics therapy, we talk about vaccination, we talk about public health interventions and all that, all stem from the germ theory's core principle. Now, let's look at the contribution. I've mentioned vaccine from Edward Jenner's smallpox vaccine to today's mRNA innovations, antibiotics from penicillin to multi-drug therapies. So through the germ theory, we can talk about vaccine production by Edward Jenner. We can talk about the mRNA vaccine produced by BioNet, by Pfizer, a whole lot of them. And then we talk about antibiotics. A lot of diseases have been cured by antibiotics. But the thing is that antibiotics, though, have saved a lot of lives, but may not have added value to lives. But that's the reality. It has saved lives. But the value, has it really added any value to life? But it is all credit to the germ theory. Now we talk about evaluating the scientific evidence supporting germ theory. Koch's postulate will come handy. A set of criteria providing that specific microbes cause specific diseases. So anytime you hear of, for example, Mycobacterium tuberculosis causes pulmonary tuberculosis, is all attributed to what? Koch's postulate. He specified that certain microorganisms, specific microorganisms, are responsible for, a specific disease. So our identifications of microorganisms or pathogens in the lab is all credit to what? Koch's postulate. Now we talk about sources of antibiotics and vaccine effective in targeting and controlling microbial infections, confirming microbes as direct disease agent. Antibiotics, yes, because we use antibiotics, because we are in a microbiology lab, and if we want to, identify a particular disease, we can go through the cultural method, get the sample, culture in the laboratory, and then we identify the microorganism. Once they are identified, and then we do our sensitivity test to see that this organism is sensitive to a particular antibiotics. So we can use that particular antibiotics to actually kill, the microbes. So it is all, credit to the germ theory. Now we talk about contagion models. It predicts disease spread via pathogen transmission, supporting the roles of microbes in outbreak. Yes, that, contagion, that you can actually contact disease, because of course we believe in the external threats caused by microorganisms. Credit to germ theory, that when you come in contact with somebody having a particular disease, by coming in contact with the person, you are most likely to get it. That's just a credit to the germ theory. So what are the theories or points challenging the germ theory? There are some symptomatic carriers. What about people that have microorganisms in their system and they are not falling sick? So if you say microorganism is the sole cause or the principal reason why people have infectious diseases, what about those that have the microorganisms in their system and not manifesting any sign or symptoms? Again, you can see that the internal terrain may be called into play, because you can live in harmony with microorganisms without causing any disease. So by the mere presence of microorganisms in a particular place or a particular locations of the body does not always directly translate to you having a disease. So it all depends on your internal terrain. If your internal environment is healthy, you can actually be healthy. But that's one of the theories challenging the germ theory. Now, the chronic non-infectious diseases. Now, conditions like cancer or diabetes have no clear microbial cause, suggesting other mechanism beyond germs. So the germ theory cannot categorically say that every disease, every ailment, every malady is as a result of microorganisms, because you can't directly correlate cancer or diabetes or some of these or most of these chronic diseases to any microbial origin. So by that, it is a fallout on, the germ theory. Again, antimicrobial resistance. So if you say microorganisms are sensitive to a particular antibiotics, what about even after the cross-matching, after the sensitivity test? Some microorganisms are still not or some antibiotics are still unable to kill a certain microorganism. So you can't say microorganism, or rather antibiotic is directly correlated to killing microbes, because there are microorganisms that essentially resist antibiotics. So that is that about the germ theory and the terrain theory. Now, how salutogenesis differ from pathogenesis? Let's have it in perspective. You talk about the focus. The focus of salutogenesis is on health promotion and well-being, while that of pathogenesis is prevention and treatment. Now, the salutogenic model asks the question, what makes you healthy? What factors contribute to health and resilience? What actually makes you healthy? But the pathogenic model asks the question, what causes disease and illness? Then we talk about the approach. In salutogenic model, the approach is on positive health determinants and coping mechanism. Like you must have a positive mindset. You must cope, have a coping mechanism. That of the pathogenesis focuses on diagnosing and eliminating disease-causing agent. The theoretical basis based on sense of coherence, and then the ability to manage stress. The pathogenic model focuses on germ theory, pathophysiology, and risk factors for disease. Then the application in salutogenesis, it is applied in public health, in psychology, and lifestyle generally. We are all incorporating the models of salutogenesis. But when we talk about clinical medicine, epidemiology, and pathology, we are incorporating the the pathogenesis model. Now, at the end of the day, you can see that there is a correlation between salutogenesis and pathogenesis, and that it is good we incorporate the two models, for a robust health. We can actually incorporate the two models for a robust health. If, for example, talking about vaccine, it is not bad to give vaccine. Like, I know some people are anti-vax and they talk about vaccine in bad light, but the thing is that it's about reaching an agreement. Instead of giving vaccine to people that are immunocompromised, people that have no immunity, we can allow them grow and develop a certain immunity before injecting vaccine. It's about, agreeing on a consensus, and that can happen. So you can as well, for example, be taking your antibiotics and then using alternative model to counter the, adverse effects. It's about reaching a synergy. Do you get me? So we talk about complementary. The orthodox medication can complement with the alternative medicine. You're all about reaching or having a robust health. So thank you.